Hi, I am Dr. Titcher, and as one of the veterinarians here at Easton Animal Hospital, I do small animal medicine and surgery, but I also happen to be certified in veterinary acupuncture by the Chi Institute. Today I'm going to go a little bit over about what acupuncture is, and we're also going to show you an example on one of our patients named Sammy.
So this is Sammy. Sammy is a 5-year-old Great Dane, and as you can see, he's got some stuff set up in him right now. Sammy came to us because he happens to be owned by one of our technicians, and as you also can see, Sammy only has 3 legs. So Sammy started with us with acupuncture because as a Great Dane and a bigger breed, he started with some weakness, just some uncomfortability in his hind limbs, but once we had to actually remove one of his front legs due to some cancer, we have been also doing some acupuncture to help strengthen the remaining front leg since he puts a lot of weight on that leg.
So acupuncture is the stimulation of a specific point with a specific method that results in a therapeutic homeostatic effect. These points are what we know as acupuncture points or acupoints, and they have found about 173 on animals. The concept of acupuncture is that there's chi, which is the life force that flows throughout the body. You want chi to be flowing smoothly, and any sort of disruption of that chi or blockage of it can lead to disease and to pain. Pain is that blockage, and we want to be able to open it up. On an acupuncture point, there's the idea that there are nerves and blood vessels coming together, and when you stimulate those nerves and blood vessels, you can help make sure that everything is flowing smoothly.
These acupuncture points can actually be stimulated in a variety of ways, including one is called dry needles, and that's the needles you can see here that don't have anything attached to them. You can also stimulate it via electrostimulation, which is what this box is right here. You can see that there are electrodes hooked up to some of the needles, and we are adjusting them to different frequencies every few minutes to kind of help stimulate the points and stimulate the different pain receptors and stuff. As you can see, it's a little bit higher, and his body actually just flinched a little bit, but it's not painful for him. No matter how we do these techniques, the goal is always to restore the flow of chi and allow homeostasis to return. Acupuncture induces pain relief, regulation of your GI tract, there's an anti-inflammatory effect, immunoregulation, and there's also like an anti-fever effect and promotion of circulation. You can use acupuncture for a variety of conditions, including musculoskeletal, neurological, GI disorders, chronic conditions as in asthma, behavior, kidney disease, and other metabolic diseases. People also use it for performance enhancement and to help prevent disease. Acupuncture is very safe when administered by someone who is qualified, such as myself. Each session lasts between about 40 and 60 minutes because it just depends on, they're usually only on the treatment itself for about 20 minutes at a time, but we're usually checking how everybody's doing. It takes some time to apply those needles as well. And the number of treatments depends on the nature, severity, and the duration of the disease. On average, about a series of about 3 to 10 treatments can resolve a lot of problems, and we kind of space them out based on how they are responding.
I hope you enjoyed our info session on acupuncture. I know Sammy did. Come on, Sam.